Kuatsi stahanutimis. Waatu sinume tapu. Kaita tawa hawetsi te. Hawenetsi fkatsem fkau fkaiutimis. Ats fkaiutimis. Atsi hawenetsi nana papa te autsi kutruotranis. Hawenetsi fkau fkaiutimis. Kutonatsi atiasti fkautranis. Kaita tawa hawetsi kutruoajasti. Tawa stahanutimis. Kaya ni waika traitsi horsi fra atse. Yu hima kai so na haitsi. Nachuena. Emetsi hoen tsi uistia anitsi na tru out. Kaya amom ha atsatsi it kaitrano so ka trait. Hoetsi nai atan ya trate frustats. Me yo na kai to hiatsin chai fwetsi kanst. Hey sia kai nan amitsi kai watranit. Et yu hima kai tawa hoetsi yu ko tsi chichanatsi go. Kai kun tsi ko shuto ni marsat sahanutimis. So na haya. Wa hatin tsi algo. Ats no hawi dersi kutsanut. Kutsano zesh. Eme gaitsi ego. Gaya shadrana. How etu oika right. Ya naistietsi nyawat tanita. Nyawat tanita. Squatum anish. They agutu. Eme gaitsi. Nats. Zat yo huchani, aititsi ka ata. Gaik au nama, sku nama. Yu mutstrua nama. Tsi hopa. Zat yo huchani, atska naitimish. Tsi ka au kuyawat. Yabt afrumitsi ku atyate. An daishtitsi ekona netruth hefkwadruma. Ta apat strua namas ahanatimis, frau niwan na trua nama. Frau notimutsi amum atsi frau dranis nia. Etsi hos new atanitsi, tsatio hutani. An etsi daishtitsi netruth kortumanis. Za hatitsi kaus kayut tsi odrani. Et an waika freitsi in aujutse e kursi eni otrat sortumanis. Frau emeto hopa tsi niau amatsa nit tsi zat yo huchani. Kukai kuskuto nimarsat so atimatemish so akashait taiti tsi sa te emish. Wai kustitsa huchani. Hopa etsi e kushait rat tsi. Shait rat tsi. Kai chame nats pirskari. Taititsa ka ata. Kai utruto nimarsi, traitru nimarsat. Ewa tiu nats pinspari tsik. Taititsi ka ata. Kai su atimatimish, waikustitsa. Kai stiu namatsanish, tsin iwi tuana, shursach. Et no, naistia, you mean that if kai nai tranish. Kai ta atsi ekus atimatemish. Et mutsi, yab kashumitsi, uatiate, stits to atiate. But strua namas ahanatemish. Kai etsi kuarsa emitranitsi, me yona nitruthse shortuma. Kai amusha hopa amushus si fra auchanit itania fra oyu kai fratsut himas efsi an hopa si taistit si na etrutse frus za hatit si quifko autrania Etse ko hostit sina shaats eno. To skoti na trutse frus. Na chaman haish ka aitran. Still namatzanis si taisko tawatsi nevets anaima sho trumas sis anotimis. Sho emitotsi nitran a hopa. Seg anetsi tawastis aitra ku tawas ni outras quatruma. Zatsina to hiats and chairsi hoen amusha hanotimis. Zinu apets so trum anno. Et aneme iona zi taitiutsi na tra astit frus si fra hanotimis. Anemi na tuke yani taitiutsi hanona taku. Ta amu mi fra hanotimis. Tiam ako etsi fro a. Sha'awi sha'yu itimis. Ats hat shruyet naetit mars etsi santaro etsi kaanit kutsi haitsi pinats washtim tsi fkai wat tanit. Emisho ho patota atsi amu shrin irsi amusi na yautra nitsi. Tawa ho etsi ti ershursach. Tawa ho etsi truwa shursi sha'awi sha'yu itimis. Ko an etsi kanatana maikwe kaidrani. An etsi kanatsi snau akchana shursi. Amusti sna yatrana shurs. Shros ahana timisto mame eme etsi ekonatritsist. Eme etsi en aitrakuni. Eme ni outras kotumanis. Himas ek hauye. Kuma hoka trunitsi shama shanu. Eme etsi eko eni outras kotuma. Eme etsi niuk chana shurs hopa. Ta atsi ekus ahana timisti shaeni kutsi. Amum atsi na trait yani shurs. Frus hopa. Ms itranat. Himas eksa ayut. To ersi eko hauena metsi ni wakt kotuma si. Amostis ne atranat kotuma. Kotona si to chayar. Tona si himas eksi ni awanatranat saumas. Tsiak ama. Tona si na no anatko. Taas anotimis. Taasi eko kaituk enakti noju raatsaanish nietuk enakti eko erraitsko. Si ersatsa. Kai etu shamutsano katseni. Tuk enak etsa hatni wa pershawatruma. Shramitzik achach krus. Kun ayab enak krus hau enak si tsatsema. Ko amosha timis. Yu hima tsi etmutsi tai tsi. Ik tsi sha'aw sha'yu timis. Zata atsi to technology how etsi e go tranish. How etsi nai apen akrus nai ayush kaitsanita akrus si. Ba ko kai si shkaishi meet si cell phones. Emitotsi ba how etsi try up enna. Hima kai taisti yuk uminatsi ta ansi no itrasti. Tuk enakti ni up enna shortumas. Bam etzana tsi eko. It eit tanutsi it en aitra gunutsi. Sayutse ayawat yamitsi ni otrash kortumanish. Etceta tuk enakti. Tau atra tsam atsi tuk enak ni up shortuma. Tsi tai tsi fkai trushanish. Tsi tai tsayushanish. Kotoa hiats in ich ayers nia. Sek tuk enakti ni up shortuma. To wawa tseshanish tsi. Emekai tsi ainawat. To wawa. Kai tawa etze hat to erstif ko tsek. EU hat tsi mish emetsi. Wow, what's a teacher not to see? He must actually say a partial growth and you state you. You na if cano says, you na hanista punished for me hem ekayhano. Emeto see, wow, says see. Hey, a partial see growth and you. Freeway at me yona to ersi ni wa sek quartuma. It a hopa tai tu see frahano tims emik amu. Tiam ak tse emish. ite etmutsi to wawatsi truotrani kursi. Ta saan timis. Ta kaiwatik enaksi, ta shiatsi fratsanisi. Emetsi eko ersatsa. Hello again. Good afternoon. It's Saturday afternoon. I actually went out and did a walk. It felt good to be outdoors, to do a little bit of exercise this morning. But I'm very happy that I could make this first video and to extend my greetings to all of you, my people. I hope that all of you are well. I hope that you and your families are in good health. I hope you're happy and doing as best as you can to maintain your households, to keep uplifting one another during this challenging time. And as I said in our language, while my tribal administration and I were anticipating being relieved from these duties, we have accepted this responsibility again this year on your behalf. And our traditional leaders at Acoma, our 3 new tribal sheriffs and 2 new tribal councilmen have all accepted positions for this year. And we will all do our very best on your behalf. There's plenty of work ahead of us. We need to work towards recovery and healing from this very traumatic experience that we've all had. Every individual throughout the world has been impacted by this pandemic. And so there's still plenty to do to really work towards that healing and recovery for all of our country, people around the world, and our own beloved Acoma. So I want to say thank you for the support offered to us last year, the prayers that you've extended on our behalfs, the gifts, the letters, the emails, the phone calls. Whether you called out of frustration or great concern for something that was impacting you and your family, or if it was calling to offer us words of advice and guidance or ideas, or if you were calling because you just wanted to say thank you. We really appreciate that outpouring of communication from many tribal members, those of you who live on the reservation and those of you who live far away, those of you who live in Albuquerque and Grants. We appreciate the time that you took to communicate with us on the various issues that we were all dealing with and continue to deal with. Even this year, this first month has been very busy for us. And we hope that we've been able to answer your questions. We're glad that the Tribal Council has continued to authorize some aspects of the precautions that we've taken, including the checkpoint, the food pantry, the health command, and now initiating a process for vaccination of our tribal members. And we encourage all of you to contact us directly. Contact us. You know how to reach the tribal office. Send an email, or make a phone call. If some of you prefer email or writing a letter, that's also welcome. And many of you already have done that. So we encourage all of you to continue to make those inquiries directly to us. Please try to refrain from the gossip and the hearsay and the assumptions that get spread very quickly. A lot of it through social media, plenty of it through Facebook. But if you want to know something, if you want to know the facts, if you want information or need information, please contact us directly, or the Health Command, or our respective tribal programs. So with that, I want to offer some information today. This message might be a little long. We're already into 15 minutes right now. But I want to share some things with you that you need to know about. And I will continue to make these videos moving into the next few months of the year. We'll see how things get, what the condition of the pandemic will be in the coming months. I'm hoping that there will be some opportunities for us to have some engagement with you. We didn't have all but one tribal general meeting last year. And so we want to be thinking or introduce other ways to communicate with you in this year. I want to just let you know also that I'm really grateful to the programs, some of the programs last year, including our Department of Education, who did an awesome job at reaching out to the community. It was really important that to the Board of Education and the staff of the Department of Education, that they offered as much support to our families and our children during this time of virtual learning. I really appreciate that they were hosting the community virtual gatherings, and those were very helpful. We tried to participate in all of them, and it was really great to see so many of you join in those virtual meetings. And I hope that I'm sure they will continue, and just really continue to offer encouragement to all of the parents and students to join those future gatherings hosted by the Department of Education. And they also, of course, had a language summit concerning the dictionary project that is ongoing, and some of the other initiatives related to language or Acoma language preservation. So I really commend the Department of Education for stepping up in a profound way to be in direct contact with all of you. Our Department of Health and Human Services also does an incredible job at maintaining their current programming, while also introducing new programs and support groups and virtual platforms, so that there's a level of engagement by the community on the various issues that concern our community and that concern all age groups within our community. So please continue to take advantage of these resources that are offered through the Department of Health and Human Services. The staff there is a large staff, and they work very hard to, with the input of the community, and also in consultation with other programs, to ensure that there is a high level of quality of programming that is available, not only to address the challenging issues, but also to spark new conversations around various issues, and to gain a better understanding of what it is that the community members are thinking about, where the various issues are concerned. So continue to take advantage of those. And I also understand that there will be additional programs who are going to be launching other outreach to the community. We are also working, and last year working with our, some of you might know Tony Chino, who works here at the Tribal Administration, and he's been spearheading the redesign of our tribal website. So we hope to have these virtual platforms using our new websites. And so a lot of those will be rolling out here in the next few weeks. And some later in the first quarter of the year. I want to start off with the issues concerning the pandemic. First of all, I am very, very happy to report that we currently have 0 positive cases in the community. Very grateful for this. Everyone's prayers and everyone's cooperation has brought us back to this. Do you remember in September of last year, we were at 0 cases for several weeks. But then we had that awful spike in November into December. Over 100 positive cases, and the largest percentage of deaths that we realized here in our community. We had to institute the lockdowns, the weekend lockdowns, and that has had a tremendous impact over the last few weeks or months, the last 2 months. And we've seen now the steady decline in the numbers of positive COVID cases here. And so we currently have 0 cases. So happy for this. And I hope that we can maintain 0 cases over the course of the next weeks and months. But it continues to take everyone's cooperation. All of us need to continue to follow the executive order. Now, if things continue to get better, and as we roll out the vaccination plan, we also hope that we will be able to revisit the executive order and begin to make modifications to that order so that we can have a little more freedom. But that means we will also have to do more work in terms of testing and monitoring of our community, so that anytime we might realize an increase in cases, that we're responding to that situation and avoid any spread of the virus again, like we experienced back in the latter part of 2020. Unfortunately, we have lost 23 tribal members since the pandemic. It's sad. It's frustrating. We all question why. We all hurt along with the families who are directly impacted by these deaths. And I just thank all of the community for being very sensitive and being showing and extending your care and your love to the families who have been impacted by the loss of a member due to COVID. Thank you for showing your love and respect to those families and all of their relations. Any death impacts all of us. And let's continue to pray that we no longer have to experience any additional death, loss of community members. Since the onset of the pandemic, we have had a significant number of positive cases. As of today, we have had 430 cases on the reservation. And we have also had 78 tribal members who live off the reservation who have unfortunately had caught COVID. Happy to report that we only have 1 tribal member in the hospital. Also happy to report that we have less than 10 tribal members in quarantine. So we've made some really good progress. Let's be grateful for this. And let's all not let our guard down. We can't let our guard down. We have to be vigilant in the days ahead to ensure that there's no additional cases, no additional spread among families in the community. So thank you again, everyone, for your patience with us as we've, had to take very immediate action and establish stringent guidelines for our community. And I want you to know also that our community, just like any other tribal community throughout the country, has been hit hard by COVID. And all of us have taken very similar actions to ensure that our communities are safe. Many pueblos in New Mexico continue to be locked down. Many pueblos have much stronger guidelines than we do, but their populations are also very small, and they risk great loss if they don't take these strong measures, put them into place to safeguard their people. So we're doing all that we can to fight against the spread of the virus. And our current numbers show that everyone's cooperation does yield very, very good outcomes for our community. Please continue to be careful. Take every precaution. Limit your travel off the reservation. And look out for one another. The checkpoint will stay in place until further notice. The food pantry will also continue to operate, and I'm glad that many of you continue to come and receive the biweekly distribution of food. We hope to do more distributions for those who live off the reservation, and we'll definitely keep you apprised of those dates that we can get off the the reservation to make those food distributions. The lockdowns will also continue. There's already been notices about the lockdowns will continue for February. Standard process that we have today, like this weekend, closing at 8 p.m. on Friday nights and reopening on Monday morning at 5 a.m. So those will remain in place. We realize that the executive order also still limits our capacity to open tribal government operations. So a lot of our offices remain closed. A lot of our employees still work from home. We only have essential employees on staff. We've just only recently reintroduced some services like curbside trash pickup. There's a lot of things that, depending on what our situation is in terms of positive cases, really guides these decisions. So, if we can maintain very low numbers or zero cases, it gives us an increased opportunity to expand operations and bring people back into the workplace. And I hope that in the coming weeks or next couple of months, we'll be able to begin looking at, opening more of our tribal businesses and bringing people back to work. So there's plenty here to be considered. Also looking at and considering our education of our children. All of our children are still virtual learning virtually. The Grant Cebal County Schools, many of you probably have heard that the governor of the state of New Mexico has authorized some re-entry into schools, some introduction of hybrid models, and I believe the Grant Cebal County Schools will likely consider those. But we also need to consider all of the implications of reintroducing the students to the bus ride from here to the Grant schools. the impact of students in the classroom. We are very interested to know about the vaccination of frontline GCCS employees and teachers. Make sure that if students are going back into the classroom, that those employees and teachers are being tested regularly, that they've been vaccinated. And so those are, really important things that we will be monitoring as these discussions continue around reopening schools. Our Department of Education will also likely continue their discussions around reopening or reentry of students into our 2 schools. And I'm sure that they will continue to be in contact with the families and our community on these issues. The other thing is, we have the vaccination that is continuing. I mentioned last year that we had the opportunity to either access the vaccine from the Indian Health Service or from the state of New Mexico. And we opted to go through the state of New Mexico Department of Health. And it's been a really good relationship so far, though it's frustrating for us because we don't really learn ahead of time how many vaccines we will be receiving. So it's really like the first vaccination we found out the day before. And so there was no prior notice given to us, and we had to really scramble. But the tribe does have a vaccination plan. The Health Command has developed this vaccination plan, and it really lays out the details of how the vaccine will be administered, information about the vaccine itself. As you know, there are 2 that are available right now, Pfizer and Moderna. There will be a Johnson & Johnson version, hopefully available soon. There were many complications in the distribution from the federal level last year of the vaccines. Many of them, unfortunately, went to waste because people weren't prepared. Different towns and cities and other entities were not prepared. And unfortunately, some of the vaccines got distributed to the retail sector, which was not part of the distribution strategy. So that impacted then the number of doses of the vaccine that some of our communities received. But we're hopeful that now that the state seems to have a better grasp on this, and now that also the Indian Health Service has also been rolling out the distribution of their vaccine distribution, it really is providing us a better opportunity and a much better outlook for what vaccination will be for Acoma in the coming months. The initial vaccination was, again, like I said, it was a little complicated. It was not well planned because we had less than 24 hours to actually make some determinations. But our Health Command Center has been working closely with the Department of Health to determine, at least in that couple of initial vaccine clinics that were held at the casino, that we take the data and use the data from the Department of Health. They were the ones who recommend to us the and I guess it's a random process that they have for selecting elders and selecting other members of the community to be vaccinated. But we did follow the state guidelines for essential and frontline workers. So we were able to vaccinate a large majority in that first and second vaccine clinic, a large majority of our frontline employees. The third clinic allowed for the vaccination of the remainder of the essential employees. I think we only have a few more from McDonald's employees and also ABE employees who still need to be vaccinated. One of the other priorities for us were the cultural leaders. And so this was very important that we made sure all of our cultural leaders were considered for vaccination. And most of them have been vaccinated or are scheduled to be vaccinated or to receive their second dose. So we're very thankful that there has been enough doses coming to the Pueblo so that we can vaccinate these groups. The next vaccination clinic will be on February 12th, and we are scheduled to receive 150 doses. However, about a week and a half ago, I sent a letter to the Department of Health and Governor Lujan Grisham asking the state to increase our number of doses to 300. So I'm hopeful that they will give us consideration and give our request consideration, and we will be able to receive up to 300 doses in the months and weeks ahead, so that we can begin vaccinating more of our general Acoma population. Now, that selection process is going to be an open process, just really, again, similar to what how the state is managing this. So it will require people to register to be vaccinated, and really on a first come, first served basis. There still are some criteria associated with this, and so like the elders 65 and older, those who have underlying health conditions are also considered, and then also any tribal members, for example, those who live off the reservation but who are frontline employees, who work in public safety, who work in the healthcare system, who are educators. Those are the individuals also who get consideration, will continue to be given consideration. And then also students, our Acoma students who are required to return to their respective colleges and universities for face-to-face or in-person instruction. Those students also are given priority. So that's how the priorities are exist at this point, and the Health Command will be notifying the community, and there should be some flyers out in social media, and also we will distribute these at the checkpoint. All of this information is on the Pueblo of Acoma website on how to register to access the vaccine. So like I said, hopefully we'll be receiving double the amount that we're receiving now. And if that is the case in the weeks ahead, the vaccine clinics will be scheduled probably bi-weekly. And of course, we all know that there are 2 doses that are required. So as these doses are coming in, the Department of Health monitors the distribution of the second doses, and then our Health Command organizes the clinics for them. So it's been a good partnership so far. Unfortunately, sometimes we see people waiting a long time to be vaccinated, but that's just the nature of this distribution across the country. Some people are waiting 4 or 5 hours in different cities and towns to get vaccinated, but unfortunately that's just what is required as part of this. And hopefully as these processes get more streamlined, the wait time will be lessened, and we've encouraged our Health Command and the state of New Mexico to ensure that the timing is given some consideration, because we really need to ensure that people are vaccinated in a timely manner. So especially where elders are concerned, who are in line for 1 or 2 hours until they're vaccinated. So those things are still being worked through. But we're very happy that we're able to receive the vaccine. And I encourage those of you who have maybe second thoughts about getting vaccinated, or who we've had many elders and we've had some of our cultural leaders who have declined to receive the vaccine. But it is safe. It's for our own well-being that we be vaccinated. So I encourage you, and those of you who have elders in your family, or maybe members that are in your family who have maybe are questioning or doubting, or who have refused the vaccine, talk to them and reassure them that it is safe. I know that some of us have very strong cultural beliefs around this, and that's understandable. But on some level, all of us also consider and depend on Western medicine. A lot of us are on medications already. A lot of us get the annual flu shot. And when we get sick, most of us will go to the hospital. So we depend on Western medicine a great deal. And here's another way that we can protect ourselves during, especially this time of pandemic. So I really encourage all of you to, to register to be vaccinated once the information is disseminated. The next item I want to cover is regarding the ACL hospital situation. I'm sure that many of you have been following the news on the ACL situation. I brought this to your attention last year, and we finally got to a point where we just could not accept what the federal government was telling us. And last week, earlier this week, we filed a lawsuit against the federal government, specifically the Department of Health and Human Services and the Indian Health Service, for their negligence in providing the health care to our community, and for their dangerous behavior and actions that caused the emergency room service to end at ACL, inpatient care and other critical services that some of our tribal members depend on. This was not acceptable to us. And so we authorized the filing of an order in the federal district court in Washington, D.C., and a hearing took place yesterday. And we were fortunate that the judge ruled in our favor. And so what that means is that there's been a temporary restraining order issued by the federal judge against the Indian Health Service. So they cannot close the hospital. They cannot terminate these services. They have to find a way to continue to maintain the operations there. So very grateful for that outcome. We still have some work to do. In 14 days, there will be another hearing. And at this time, we hope that we will have a preliminary injunction, which means that the federal judge would also then again direct the Indian Health Service and the Department of Health to do all that it needs to do to ensure that funding and staffing and everything else that's required to maintain the ACL hospital is achieved. Now, this doesn't guarantee the longer term situation that we face regarding ACL, but what it would do is ensure that the ACL hospital is open throughout the term of the pandemic, and perhaps even one or maybe another year after that. So we have to be thinking about what the next steps are for the Pueblo, where ACL is concerned. And we've certainly learned a lot of things during this pandemic relative to our healthcare system, relative to ACL hospital, and just the general health and welfare of our community. So we have more data now than we ever have about the health of our community and the healthcare needs of our community. And so one of the things that the Tribal Council has authorized is the establishment of a health committee or a health board. We're not exactly sure yet just if it's going to be a board or a committee, but we will be soliciting tribal members who have an interest in serving on this health committee to help us create a plan for healthcare for Acoma into the future. So be looking out for information concerning this. We really encourage you, if you have an interest, to submit your resume, your letter of interest. And again, all of this will be available to you either in written form or on the website. I hope that we will have information out on our website soon, and maybe in the coming week. But keep an eye out for this call for letters of interest and resumes for what would become the Acoma Health Committee. The other thing that I want to mention here is that we are also working with Michelle Lujan Grisham, our governor from the state of New Mexico. She's been very helpful, along with the Secretary of Indian Affairs, Ms. Lynn Trujillo, who is a member of Sandia Pueblo. They've been very helpful in really helping us navigate this process. And the state, has offered also assistance towards this effort to keep ACL open. And there have been many others who have been involved in this process. Of course, this would not have happened if it had not been authorized by the Tribal Council to pursue this legal action. But also our tribal attorneys in Washington, D.C., the Hobbs Strauss law firm, as well as Chestnut Law offices in Albuquerque, and also our Health Command, our Health and Human Services Department, have all contributed towards us achieving this ruling by the federal judge. So I thank all of them for their interest and their hard work. But I also want to thank our people. Many of you, I think it was well over 100 of tribal members, submitted letters to the Albuquerque Area Indian Health Office, or you sent letters directly to Washington, D.C., to the IHS headquarters. Thank you. You don't know how much that has helped. It's been acknowledged by the federal headquarters team. And so they are aware, and they know now firsthand that our own tribal members are very concerned and are not accepting the actions of the Indian Health Services where ACL is concerned. So thank you very much. Really appreciate you taking the time to write those letters, send those letters. It made a big difference in all of this process. So thank you very much. We will keep you informed as this issue progresses, and just continue to be prayerful that the most favorable outcomes lie ahead, especially in the next coming weeks. The other issue I want to briefly address, and I did earlier concerning education, is that we will have ongoing meetings. We do have weekly meetings with our Department of Education and also the Cebal County School Administration. And so we will continue our discussions with them around safety protocols and any proposed re-entry of students into the Cebal County schools. So we will keep you informed. The Department of Education is likely to be in direct contact with our children, our students, and our families. So be looking out for that information, and we'll most definitely keep you apprised. And the Cebal County School Board meetings are open to the public. So I encourage you parents also to, if you have time, to sign in to those virtual meetings that they host, so that you can hear directly from the board members who represent our areas. That's Guy Archambault and Emily Daly from Laguna. So it's always good to have be informed of those discussions. And And then finally, the last bit of information I want to share is concerning upcoming cultural events. And some of you may have received the notice at the checkpoint, but I want to formally inform you, tribal members, that what would have been next weekend, February 6th and 7th, would have been the feast for the new tribal officials, our chiefs, their mothers, and the tribal administration, sheriffs, and councilmen. This is not going to happen. It's been postponed, and we all know why. We're still in this pandemic. It's still very risky for large gatherings of our tribal members. We're just not in a position to come together like we normally would be. And many of you would be preparing probably right now for your families to honor your family members who have been appointed, and to come together and to be happy together and to enjoy the songs and the dances. But it is postponed, and we will keep you informed if we decide. And again, these decisions are not necessarily the tribal administration's, but they are made in direct consultation with our Tzat and their mothers, and also other cultural leaders. And there will be ongoing consultation with them as we move into the coming months of this year to determine how we're going to address some of the other cultural events. So we'll keep you informed, we just ask for your patience, your understanding, and know that as hard as it is for them to make those decisions, they all have the best interests of the community at heart. They want to protect all of us, and we need to protect them. And so it's for these reasons that these have been canceled or postponed. In some cases, you'll hear that for some events, there will only be a limited number of people who can go to Acoma. Maybe only those families, or limited numbers of families of individuals who are directly involved. But again, here we will keep you informed of those decisions as they're being made in the coming weeks. And then, finally, you all know we have a new president and vice president, and we're very optimistic about the relationships that we will have built with the new administration. They have already reached out to us. We've already had meetings with them, and very happy also that we have a Pueblo member from New Mexico who is working at the White House as the tribal liaison. He's a gentleman from Pewaukee, Pueblo, who his name is Pawi Rivera, who is going to be working directly under the president and vice president. So we've had the opportunity to meet with him and discuss some of the issues that are important to Acoma. And also, we're awaiting the confirmation, of course, of Deborah Holland, current Congresswoman, who is selected to be the new Secretary of the Department of Interior. And most of you know that Deborah is from Laguna, Pueblo, and she has been serving in Congress. But now she has an opportunity to take a cabinet position within the Biden administration. And we're all very happy about that and looking forward to her confirmation, along with other new secretaries of the various federal departments, some of whom we've had the opportunity to meet already. But again, hoping that their confirmations are successful so that we can begin doing working directly with them on issues that are important to not only Acoma, but to all Native people here in this country. Once Deborah Holland gets appointed, of course, her seat will be vacant in Congress. And I don't know how many of you know, but one of our own Acoma members Ms. Georgine Lewis, or Representative Georgine Lewis, who is a representative in the New Mexico State House of Representatives, is a candidate for that congressional seat. And while we are not part of her district, I encourage all of us to pray for her, and if you can, contribute to her campaign, whether it be to volunteer or even give a few dollars. But let's pray for her and wish her the best outcome for this election. It would be so incredible to have one of our own Acoma people serving in Congress. Georgine, or Representative Lewis, is already doing a tremendous job at the state legislature and has been doing so much for Native American people throughout the state, but also for all those people she represents in her district. So let's all wish her well and pray for the best outcome for her in the campaign, but also keep her close in prayer as she does her work in the state legislature. The other thing is that, of course, with the state legislature in session, they are in a 60-day session. We have had numerous meetings already. First Lieutenant Governor is handling a lot of the legislative affairs around education, but we're hopeful that we will receive some additional relief funding from the state and the federal government, but also realize some good outcomes where some of our other requests are concerned, especially those around education. There are some really critical issues around education that are important to Acoma and Native American tribes throughout the state and throughout the country. And so we're really placing a strong emphasis in our lobbying efforts around education, around economic development, economic opportunity, around health, of course, housing, protection of our cultural resources and our natural resources. So there are a lot of things that are at the forefront as we begin this dialogue and government-to-government work with the federal government, but also with the state of New Mexico. So we ask for your prayers as we do this work on your behalf. And I thank our lobbyists in Washington, D.C., also thank our state lobbyist, Mr. Conroy Chino, and others, our program directors, our community development office, and others who are working very hard on these legislative affairs. I also extend thanks to our Native American legislators and congressional representatives for reaching out to the Pueblo so early in the year to understand what our needs are. And as you know, my people, we also have other projects in progress. We have the broadband project, which is very critical at this time. The natural gas line expansion is ongoing. And of course, the creation of our own electric utility. We've made some really great progress here and are looking forward to launching that business or that operation this year. And there are many other projects that have been planned in the years past that are finally coming to fruition. And so there's a lot to be achieved this year. And I'm hopeful that we will, as the pandemic lets up, we can all be more engaged in discussions around these projects. And like I said, we're going to be looking at innovative ways of communicating with you. And we'll be sending out a questionnaire probably in the next 2 weeks, asking you for your input on what your preferences are for communication, for meetings, and so that you can provide input to us on some of these projects and programs. We're working on finalizing our strategic plan. So there are a lot of things that we really need your input on, and I hope that you all will participate, whether it be in writing or if you have the capacity to join us through using a laptop or computer, or your phone, using the technology that you have to be engaged in these conversations. So we're really excited about engaging you here this year, and we pray that we will be able to engage face-to-face with you in the coming months. So let's all look forward to that. And I think with that, let's bring us to a close here at a full hour. I apologize that this has been so long. This is such a long presentation, but really wanted you to be aware, my administration and I, the Tribal Council, the field chiefs have also encouraged us to continue to provide these videos. They also see the effectiveness of it, and any information they might want to share, they will let us know. So with that, I will end this afternoon here, and just finally, in our own language, close the presentation. But thank you very much for your attention, taking time to listen to this message. And I wish all of you well. You children, please continue to do your best in school. Be good to your parents. Be good to one another. Have respect for your family elders. Take their advice. Ask them questions. Ask them to teach you about our culture and our language. Learn as much as you can. And be good. Be good people, you young Acoma members. We're all depending on you to be good leaders, to be successful, to be respectful, to uphold everything, our core values, our culture, our language, so that hundreds of years from now, we will still have Acoma and be fully Acoma in those centuries to come. And it takes all of us. So let's all do our part. The Temish. You at the dome a day in Marsh at the school skated the Ganak show up, it's a hut chakaka, how it's show up. Go out they see sky trush and sees an itemish pin spari. So Artemitemish wake sleets a hoochany. How queer that you amozat your hoochany, kite the Ganak show up. But through nama. You gay hima see tree tawana see from tawanat, go out the Ganak see Merganish ear, the Ganak see show up banish. Mina kain awi at see natrush quadrum awake right. Gaish ayet see shayet see tain emania watra ni short manish. It's a go ask the emigrant nine sana timish enya watra ni short ma. Gaus gayu taiti. Shami emetsi not ist shami see nuke skunish. Doi a shea gai mina te kate matik at see day at a fruit. He must ex emetsi any outrash quarter matsi ayawatamati new outrash quarter money stays the yogo. He must train is the saya minatat see art shan it's if go outrano. Go outret mo how etsi shartrut istanish. To ersti day ititat. Hey ek out at sin aitraku. Dain axis sin aitemish pin spari ga kani etmo eme etsi eko stek eme aitraku any outrash quadruma. Da ars an temish ba me yona et ba shutsif ka ani how etsi te quia kutrus. Come yona wet you see te qui ata kutrus si no ostau trati ata kutrus nuts opewe. Etsi todo wawa session see it hima see it crew outran see bakai me etsi etsi wawa see chitran that they Shrad Department of Health Command etsi how did you ACL zik I it etsa ba how ersi stepsi no adewana crew sky me ers an temish. Hima hey akti pashuti tru trani frus. Now we are to wawa si sky it yawanasi. Hima it esho en aitrago. It snaw akchana frusi. Koshaiwe et tawarsis ka aitrano. An kanatsis. Naya dema frusi, however, na wakchana frusi, amus na yatrana frus. So emetozi na si emetzi eni wautrash kortuma hopa. Ko yona mi kano emetzi etmo zis frata dem zis ni atsh kortuma. Zis ni osti atsh kortuma. Da ast anotemis si frata na te kotrus hopa. Ba me yona an hawen zis diashka mas diusra bum. Als an each akstianish etzit straight rashed hopa. Zalzi hey a gwini ultra kutratrum anna na higher si so atimatemis at stadio huchen si zani wats arfkstjur kutratrum anish. Et bartruch mu me yon hawen si fgun amatsanish si stiu kamishat etzit straight rashed. He mars and etzikanatsi house note an ashrus. Sha oyu kai sha zuts amum atsi sha outranish. Doa emis exi. Notmo thivra etsi draiwe rus si hawe nam. Da ars ahanatim hopa amos frayat. Gutschmars ti kutsi frayitja. Daistit etsi ne truthai shrodruma. Se amos shrodruma, tene shrodruma hopa. Da ars ahanatim bars no ayen aistirza ayut. Gods and the sculpture. At no hawi der stop up to iwizoita nitsi. Yab gashum hem etzit anish. At so na high geist an itemish. Pen spari, so atimatish, wake slitza hochani. Gaidona na yastum sisho dranish. How etzin and I still see gap, stick a etzis the day, it's from it, it's the depth, shotruts and earthy. Bars ek. Eme wais, and estia, ayut, ga iani ga tat, ga timik aitzat. Hem etzit anish, bars exit straighway, it is anatims. Da hawi show hope, but always shots, seku baho enazit to ostia. Shaiwa namati, taitsi archatras sit utranit. Da hopa, but to ostiazi, tawazit straight trust, taisi yuko. Da awa kait hem etsi ko erstatsa baho etsi struos tiars anatimis. Kais and etsi kanatsi now akchana shus. Dawa Satsiwa to gouch uts. Okay, na kait. Bye bye.